I'm Vivian Wu. I'm a head and neck surgeon here at Providence St. John and Pacific Neuroscience Institute. TORS stands for Transoral Robotic Surgery. It's a tool that we use to access the back of the throat in order to remove tumors that are in the tonsil or base of tongue. If you can imagine, you're opening your mouth, you can see the front of your tongue, but the back of your tongue is where many of these tumors grow. And it would be very difficult to operate in such a space because of how far back it is. The robot has a camera that allows us to see the back on high-definition screens, as well as operate with our surgical tools, which are also part of that robotic system. The advantages of using the SP robot, which is a single-port robot, are that it's a minimally invasive approach to operating in this region. Prior to the use of the robot, the surgery was quite morbid. In other words, it was one in which we really wouldn't subject patients to unless they were really far along in their cancer. This single-port robot allows us really to provide a surgery to an area that was previously inaccessible surgically. In addition to being minimally invasive, other advantages of the robotic surgery is that the hospital stay is much shorter and the recovery time is much quicker. So patients who are appropriate and indicated to have this operation, we certainly encourage it. So we see a fair number of tonsil and base of tongue cancer these days. Many of them are HPV related. Using the TORS system is essentially one of the main ways that we use to treat these cancers. If we're not using the TORS system, then the patient is likely undergoing radiation and chemotherapy as opposed to the surgical approach. The fact that we have this single-port robot here is a wonderful addition to this community in the west side of LA. There's only a few centers that have this, and certainly only a few centers that do this operation.